Now we will discuss about the FGM safeguarding pathway. Okay, so when this pathway is to be initiated, when we suspect the female genital mutilation. Okay, so what are the clinical scenarios where we should suspect and what exactly action is required? This is given in this particular flowchart. So the presentation prompts clinician to suspect or consider FGM. So which are these conditions? When the patient is presenting with repeated urinary tract infections or vaginal infections or urinary incontinence or there is a dyspareunia, dysmenorrhea. So these will be the complaints where we should suspect or consider that there is likely to be a FGM. Okay, and also sometimes the patient may have a case of infertility, getting difficulty in pregnant or presenting for travel health advice, or patient herself can disclose, especially the young girl from a particular community which is known to practice FGM. She may disclose that she will soon undergo coming of age ceremony. Okay, so these are the things where we should suspect that either there is FGM or likely to have the FGM. Okay, so for once you come across these particular scenarios, then what is the question which we are going to ask? We will ask, do you or your partner or your parents come from a community where cutting or circumcision is practiced? Okay, so it may be appropriate to use other terms or phrases. Okay, so what we are going to ask, do you or your partner or parents come from a community where cutting or circumcision is practiced? This question will be, so you think about a scenario where you are suspecting, you ask this question. Now, if the answer to this question is no, then no further actions required. Okay, but if the answer is yes, then we need to go further into the detail, and this is what is the flowchart is telling us. Okay, so then on the history, what is the suspicion? Do you believe the patient has been cut? Okay, so if we feel that on the history the patient has been cut, then we will follow this particular path. But if there is no cutting of the genitalia for the patient, but there is a family history. That means the patient comes from the family or the community where the cutting of the genitalia is being practiced. However, the patient has not undergone the circumcision or the female genital mutilation. Then patient is under 18 or vulnerable adult. Okay, so whatever is the age, whether patient is under 18 or vulnerable adult, in that particular case, if we suspect that she may be at risk of FGM because she has not undergone FGM, so she may be at risk of undergoing FGM, or maybe her siblings may be at risk. So what the guideline says, use the safeguarding risk assessment guidance to help decide with which action or what action to take. Okay, if the child is at imminent risk of harm, initiate urgent safeguarding response. Okay, and consider if the child social care referral is needed following local processes. Okay, so if on history that the patient comes from the community where the FGM is practiced, but the patient has not undergone the FGM, in that particular, she will always be at risk of undergoing FGM. So what we will do, we will do the safeguarding risk assessment, and then we will do the if there is an imminent risk or of harm, we will initiate the urgent safeguarding response. Okay, and we will also consider the child social care referral if it is needed. Okay, so this is what is the pathway when there is no FGM, but the patient is coming from the community where the FGM is practiced. Okay, what we are going to do? We are going to do safeguarding risk assessment first. If the child is at imminent risk in that particular case, we will do the safeguard, initiate the safeguarding response, and we will consider the social care referral. Okay, so this is what is the thing. And if we further go ahead and we identify if there is a other female sibling or relatives at risk of FGM, then consider risk assessment if possible, or share information with the multi-agency partners to initiate the safeguarding response. Okay, so if this is the thing, we will do this particular thing. Okay, now coming to the case where the patient comes from the community and on the history, we believe that the patient has undergone FGM, then we will look into the age of the patient. What is the age of the patient? If the age of the patient is 18, then it is mandatory for us to inform the police. Okay, that is the mandatory reporting duty. Okay, so see here, mandatory reporting duty. Patient is under FGM, the patient has undergone FGM, and the patient is under 18. So ring 101 to report basic details of the case to the police officer. Police will initiate a multi-agency safeguarding response. Okay, so police will initiate the multi-agency safeguarding response here. Okay, so under 18, confirm FGM, mandatory reporting of the mandatory reporting duty or police informing is mandatory. Okay, but if the patient has undergone FGM, but the patient is more than 18, okay, then is it mandatory for us to report the police? No. In that particular case, what is our responsibility? Does she has any female children or sibling at risk of FGM? And or do you consider her to be a vulnerable adult? Okay, then we will do the complete safeguarding risk assessment and use guidance to decide whether a social care referral is required or not. So here what is to be done is the safeguarding risk assessment, same what we have done here. Okay, here it is irrespective of the age, here it is only for the adult. Okay, so does she have any female children or siblings? So she is more than 18 years and she has undergone FGM, then her children may be at risk. Okay, so we will find out, are there any children or the siblings who are at risk of FGM, and then we will carry out the safeguarding risk assessment. And after, for both this group, that is below 18 as well as more than 18, okay, what we are going to do, read code FGM status, then complete FGM enhanced data set, noting all relevant codes. So what we are going to note down all the findings, and we will complete the HSCIC enhanced data set. Okay, and not only that, what we need to do, consider need to refer the patient to FGM service to confirm the FGM is present. So this is the FGM where we have uh, come across maybe on upon the history. So we need to confirm. So this flowchart is applicable to all healthcare workers. Okay. So maybe at the level of the GP or other healthcare workers. So what they will do, they will refer the patient to FGM service to confirm the FGM is present and FGM type and for defibrillation. Okay, so you have to refer the patient to FGM service. Apart from this, what we will do? Okay, if the long-term pain, consider referral to urogynec specialist clinic. If mental health problem is there, we will consider referral to counseling. Then if the child is under 18, referral for all pediatric appointment and physical examination following local processes. So these are the referrals will be required. Urogynecological referral will be required. Mental health referral will be required. Counselor for the counseling, and below 18 pediatric referral will also be required. And for all these, okay, whether she is below 18, above 18, has undergone FGM or doesn't has not undergone FGM, but she comes from the community. For all these patients, these are the things which we have to do. What we have to do, clearly document the discussion and actions with the patient and family in patient's medical record. So we will document in the patient's medical record, explain that the FGM is illegal in UK, discuss the adverse health consequences of FGM, and share safeguarding information with the health visitor, school nurse, and practice nurse. Okay, so if the girl appears to have been recently cut, or you believe she is imminent risk, act immediately, and this may include phoning 999. Okay, so you have to inform the police here. Okay, so one thing we have to remember, mandatory reporting is only one part of the safeguarding against FGM and other abuse. Okay, always ask your local safeguarding lead if in doubt. So if we are in doubt, we should always ask the safeguarding lead. Okay, so this is what is the flow chart. So these particular scenarios, sometimes they can ask you in EMQs. So please remember this particular flow chart. What question we are going to ask, whether she comes from the community where the FGM is practiced. If the answer is no, don't bother about it, that it's finished. But if she comes from the community, whether she has undergone the FGM or not, if she has not undergone the FGM, but there is a family history, she is coming from the community, then irrespective of her age, we are going to do safeguarding assessment. If she is below 18 and has undergone FGM, then police mandatory reporting duty. If she is over 18, has undergone FGM, are there any other children's, and are they at risk? So safeguarding assessment. Okay. And then we have to complete the data set and all those things and appropriate them. Okay, I hope you have understood the thing. Okay, so that finishes this particular flowchart.